We generated retinal cells for the very first time from embryonic stem cells, and we believe that this could be one of the very first technologies in the clinic using embryonic stem cells. And we believe it could help literally millions and millions of people who are affected by retinal degenerative diseases such as retinitis pigmentosa or macular degeneration, which affects over 30 million people worldwide.
Since President Bush limited the use of embryonic stem cell lines in August of 2001, scientists have been stymied with their research. The Advanced Cell Technology team had to use several different stem cell sources to be able to carry out their important investigation.
We used 6 embryonic stem cell lines that were generated by Doug Melton at Harvard University, as well as 2 embryonic stem cell lines we generated here with private funds at Advanced Cell Technology. And in addition, we also studied a number of the so-called presidential stem cell lines. And surprisingly, what we found is that these privately generated cell lines from Harvard and ACT very readily turned into these retinal cells. Unfortunately, when we try to repeat that with the so-called presidential lines, we ran into a problem.
In fact, ACT's discovery might not have happened if they just limited themselves to the presidential lines.
I can honestly say that I don't think that this discovery would have been made had we been restricted to the NIH-approved lines. In fact, this raises the question as to how many other medical and scientific developments have we missed because of this current stem cell policy.
These retinal embryonic cells that ACT engineered will possibly help treat many degenerative eye diseases.
When you consider, for instance, retinitis pigmentosa or macular degeneration, what is happening is that the cells that you need to see with are starting to die because these retinal cells are deteriorating. So the belief is that if we transplant in new retinal pigment epithelium, which is what they're called, that we will be able to maintain the viability of the cells that you have left in your eye.
That's not the whole story with these retinal cells.
It turns out that these progenitor cells in the Petri dish also are producing the photoreceptors, the actual cones and rods that you actually see with. And this could be very important because not only will we be able to create healthy retinal cells to maintain what cells you may have left if you have eye disease, we may actually be able to generate the actual photoreceptors themselves, the actual cells you need to see with.
Before these cells can reach the marketplace, they first have to go through animal trials.
We already have approval to begin preclinical testing, so we already have animals set up, rodents, rabbits that we're going to be testing this in, and then hopefully we may actually test this in some larger animals as well.
Once it passes the animal testing, it goes on to human trials.
We would probably begin with just a handful of patients, phase 1/2 clinical trials. That would probably take 2-3 years. So probably it would take 5 years of clinical testing before this would become available to the public.
As amazing as turning eye disease around with embryonic stem cells is, according to Dr. Lanza, the future has a lot more in store for us.
It turns out that when you combine embryonic stem cells with what's known as tissue engineering, you really have the ability not only to create the various cells that could be used to treat dozens of diseases, but also whole organ failure, such as the heart, the kidney, and the liver. In fact, this technology known as tissue engineering has already been used to create skin, for instance, blood vessels. In fact, there are already clinical trials underway where they've created entire bladders. So there's very real hope here. This isn't science fiction.